to complete the neonatal hypoglycemia? Of course, don't passing the subject unless we talk about the infant of diabetic mother. Infant of diabetic mother is so important subject, and you should think about all events that consider important regarding this important subject. Women with diabetes in pregnancy are at risk for a lot of complications. Adequate glycemic control before and during pregnancy is crucial to improving the outcome. The effectiveness on the fetus depends on part on severity of diabetes state, age of the onset of diabetes, duration of treatment with insulin, and presence of vascular disease. So the mother, of course, may be already with diabetes, essential diabetes mellitus, or she developed diabetes just during pregnancy that we called gestational diabetes, Of course, the problems and the complications of the newborn more with the mothers that suffering from diabetes before pregnancy. That means both diabetes before pregnancy and the gestational diabetes contain a lot of complications, but more with the diabetes that present before pregnancy. So, the most important for us as acute problem, we can deal with the hypoglycemia that resulting in this event. So, we can take a general look to the possibility and why this happened regarding glucose level. So, poorly controlled maternal diabetes leads to maternal and fetal hyperglycemia that stimulate the fetal pancreas, resulting in hyperplasia of islet of Langerhans. So fetal hyperinsulinemia resulting in increased fat and protein synthesis, and then fetal macrosomia. So a lot of insulin secretion resulting in fat and protein accumulated and resulting in a large baby size. A large baby size in appearance, while the brain and ossification centers not grow are even delayed. So keep this possibility in mind. A brain not growing more in infant or diabetic mother in comparison to other body part. The newborn dealt with macrosomia, except the brain. Hypoglycemia developed in about a half of infant of diabetes mother and about 25% of infant of mother with gestational diabetes. As we know, gestational diabetes just diabetes during pregnancy, and after pregnancy, everything retains normal. So complication in form of hypoglycemia more with essential diabetes and less with gestational diabetes, but occur in both. Why hypoglycemia resulting in infant of diabetic mother? As you know, in utero, we have a lot of maternal glucose that passing to the newborn. This is a high level of maternal glucose resulting in an increment in insulin secretion of the fetus. So all the time in utero, we have a high level of the insulin that's secreted from the infant pancreas to overcome the coming glucose. After delivery, we have a cut the umbilical cord immediately. So the source of the glucose stops immediately, while the pancreatic islet cell of the newborn is still secreting a high level of the insulin. This phenomena resulting in a severe reduction in the glucose level of the newborn, because as we mentioned, we have a high level of insulin that of course secreted by infant pancreas. And of course, the infant pancreas need a few days to be accommodated to the new event and start to secrete less insulin. Keep this pathway of the hypoglycemia in infant of diabetic mother, because the pancreas of the newborn is still secreting a high level of insulin for a few days. To be in safe side in infant of diabetic mother, and to be avoid a such possibility of hypoglycemia, we start immediate feeding. So feeding should be started at the first hour after birth, and the glucose should be performed within 30 minutes of the first feeding. In a cetic infant, treatment indicative plasma level less than 30 milligram per deciliter. But in symptomatic infant, the treatment indicated for a higher level. Of course, the treatment of infant of diabetic mother not differ from that in other conditions of the newborn that resulting in hypoglycemia, but of course, a need for more extended course. The treatment is the same. We cannot repeat the treatment again because, as we say, it's the same of that newborn congenital resulting in hypoglycemia. Any question, please? Other problem that may be expected with infant of diabetic mother, birth asphyxia and birth trauma, of course, due to the macrosomia, hypoglycemia, hypocalcemia, hypomagnesemia, polycythemia, and indirect jaundice. Congenital anomalies is increased threefold, like congenital heart disease, neurological disorder like neural tube defect and holoprosencephaly, renal disorder like renal agenesis, double ureter renal vein thrombosis. Respiratory, and the most important, respiratory distress syndrome that we talk about due to immaturity of the lung, due to the surfactant that deficiency, and of course TTN in LS degree. Preterm labor is a common as a result of the fetal distress or planned early delivery. Of course, the infant of diabetic mother caused to be a high risk pregnancy or delivery. All the well-trained staff should be available for dealing with the problems that, of course, may present. And as we say, the most important is hypoglycemia. Hypoglycemia, you should think about it. Of course, if not interfere immediately, may result in severe brain damage. As we say, why? Because the brain cell depend completely on its energy on a glucose level, and the new brain is so sensitive for hypoglycemia. This is a picture for you to compare between the newborn that may be completely normal and between the infant of diabetic mother. You see the two pictures. There is no justice between the two pictures. We have a big one and we have a smaller, and that considered to be normal. Keep in mind, a large macrosomic newborn, all the time you should ask about the maternal diabetes. Prognosis, neonatal mortality rate, of course, higher than usual, considered to be more than 5 times. The subsequent incidence of diabetes mellitus in the infant of diabetic mother is higher than that in general population. The key to optimal outcome is a constant glycemic in the mother. So important to talk with the family about the effect of uncontrolled diabetes on the fetus, of course, and its effect on the mother. But the important for us is the complication that maybe affect the future life of these newborn. So this is a subject so important. Why? Because it's a preventable events if you deal with the subject in usual and in the process steps for safe pregnancy and safe delivery. Any question, please? We can stop at this point.